Unfortunately, I don't know why this didn't take. The first column is supposed to be the rank of the primary causes in different age groups. The first column is 1 to 4 years of age. Oh no, the first column should be infants. Second column 1 to 4, and the third column 5 to 14. I did try to correct this last night. I'm not sure why it didn't happen. Yeah. So the primary cause of death in an infant is congenital anomalies. That is cardiac disease, neurologic disease, other chromosomal disorders. And the second cause is short gestation and low birth weight, so prematurity. Still, SIDS, pregnancy complications, and respiratory distress syndrome, which is, of course, also to do with very often prematurity, but in a relatively older age group, gestational period. For the 1 to 4 year of age, the primary cause is accidents. Okay, this is the age of curiosity. And the followings are congenital anomalies, malignant neoplasms, including things like medulloblastoma, which is a tumor of the posterior fossa, homicide, and sequelae, I guess, of heart disease, congenital or otherwise. Yes. Yes. Yeah. Well, there's not a lot of, comparatively speaking to adults, there's not a lot of deaths, but yes. And then finally, when you get to the 5 to 14, again, the second cause becomes malignant neoplasms, followed by homicide. Okay. So there are some studies that estimated what the need is out there for pediatric palliative care. We know that mainly due to technology, that there is increased survival of infants and children with congenital anomalies, prematurity, and post-accidents. And that evolves into this entire group of patients with special health care needs. In 2001, complex chronic conditions were estimated to cause about more than 15,000 deaths in the age 0 to 24, and that was back in 1997. And they estimated that there were probably 5,000 patients per day in America, pediatric patients who may be hospice eligible. Again, if you think about the number of adults who are eligible in a day, this is a very small number. This is an Children's International Palliative and Hospice Care group that estimated about 8,600 children per day would benefit from palliative care services. So there is a need. Just before we go on, I need to clear up some definitions. You'll see these terms in pediatrics. Anybody who's born after 37 weeks of gestation is considered full term. A preterm or premature infant is somebody born at less than 37 weeks. And the word infant in pediatrics means a patient less than a year of age. Low birth weight is considered less than 2,500 grams, right? A very low birth weight is considered a patient born at less than 1,500 grams, which is about 3 pounds. And extremely low birth weight are patients that are less than 1,000 grams. And I was a resident in 1981, and we actually didn't often even resuscitate patients who were less than 1,000 grams. And now we have patients who may have some deficits, but who survive and have a quality life. So it's interesting how the technology has changed. The neonatal period is considered to be the first 30 days of life, and the post-neonatal period is after 30 days of life. So if you see those terms, they have specific meanings. Sorry about this again. This is the top 5 causes of mortality in infancy, divided into those periods. I believe the first column is supposed to be the post-neonatal. So let's take the middle column first. In the first 30 days of life, neonatal causes of death. The first cause is short gestation and low birth weight. Congenital anomalies, complications of pregnancy, respiratory distress syndrome, is something specific that's due to a lack of surfactant and immature development of the lungs. Believe it or not, patients who are a little bit older, 32 weeks to 34 weeks, seem to develop it much more seriously than younger fetuses. So we now use actually inhaled surfactant to treat that. And then finally, placenta and membrane complications, abruptio placenta, etc. If you look at the post-neonatal, I just want to see how I was supposed to do this. Post-neonatal is the first column. That's after 30 days of life. We have congenital anomalies and then short gestation. And finally, in the infancy period, the classic age for sudden infant death is about 4 months of age. And usually we don't see it after 6 months. Do you all know what sudden infant death is? You've heard of it? It used to be called crib death is one of them. And you would have a perfectly normal infant who was doing well go to sleep, and in the morning the patient would be found unresponsive. Again, a couple of years ago, I guess probably about 10 years ago, a little bit more, the Academy of Pediatrics, American Academy of Pediatrics, started this campaign and found there was a significant correlation to the position that the baby was in when found. And so then suggested that you put your baby on the back to sleep. And I was just glad my son was older at that point because he would never have gone to sleep on his back. It was his least favorite position. And it was found to have very statistically significant correlation. And the incidence of SIDS dropped tremendously when people started to follow that recommendation. And again, in the infant, we have complications of pregnancy.
How long is the baby on the back for?
As I said, we rarely see it after 6 months. I was the happiest person alive when my child was older than 6 months. You know, as a pediatrician, you can imagine the kind of things you worry about in infancy. And then finally, the last column, again, in the infancy period, sudden infant death, which is, again, the incidence is really, really declined, followed by complications of congenital anomalies, then perhaps accidents, or their sequelae, infections, and finally homicide. Again, and that's for somebody in the 1 month to 1 year age, in the infancy period. Talk a little bit about congenital anomalies. The definitions vary, but generally, if we say that there are structural defects present at birth, that would be adequate. They can be inherited. They can be sporadic. Detection methods include a physical exam, laboratory studies, radiographic studies. There are also fetal environmental causes, such as drugs, infections, nutritional deficiencies, injuries. Chromosomal or genetic causes occur in about 1 in 100 newborns. However, most of them are not lethal. About 1 in 200 newborns inherit metabolic disorders or sex chromosome anomalies. Serious malformations obviously involve the heart, the brain, or other vital organs. Fatal inherited disorders are generally neuromuscular or metabolic disorders. Talk a little bit about congenital heart disease, because it's one of the very big causes of mortality for patients who succumb due to congenital anomalies. And so it's the major cause of death in children with congenital malformations. It occurs anywhere from 0.5 to 0.8 live births, accounts for 10 to 25% of fetal deaths, and about 2% of premature infant deaths. Improved outcomes are due to advanced surgical techniques, and survival is still limited in those with uncorrectable lesions or coexisting malformations. But sometimes when you inherit a congenital defect, it's not only the heart that's affected, it may be the kidneys, it may be the brain as well. Cyanotic congenital heart disease. This is congenital heart diseases involving central cyanosis, that's the lips, or blue, or the fingertips. We used to talk about the 4 T's, but it's probably better to think about the 5 or 6 T's. That most of the congenital heart diseases begin with T. And so if you're asked that question, I understand there was a lot of pediatrics on the most recent boards. And cyanotic congenital heart disease, think about something that begins with T. The big five are the tetralogy of Fallot, something called truncus arteriosus, tricuspid atresia, transposition of the great vessels, and total anomalous pulmonary venous return. Okay. And then number 6 is tons of other conditions, other cyanotic lesions or variants of these congenital heart malformations. So I just want to go through them.